1, and we're live.
Good evening and buenas noches. I'm Barbara Ferrer, Director of the Los Angeles County Department of Public Health. And thank you for joining me for this virtual town hall on the reopening of Los Angeles County. I'm here with County Health Officer Dr. Muntu Davis, Dr. Sarah Kurian, the Director of Medical Affairs at the LA County Department of Public Health, Lisa Frias, the Director of Environmental Health, and Dr. Rob Gilchick, the Child and Adolescent Health Section Chief, also at the Los Angeles County Department of Public Health. We're going to be answering questions tonight about COVID-19, the vaccine, and the upcoming reopening of LA County next Tuesday, June 15th. To start, I want to tell you a bit about how tonight will go. We'll start with some brief remarks from our panelists and then spend most of our time answering your questions. As a reminder, you can send in your questions on Twitter, Facebook, or YouTube. Y si quieres escuchar en español, por favor, marca al 1-888-664-1453. California has some of the lowest transmission metrics in the country, according to the Centers for Disease Control. And this is not an accident. It's a result of the many hours invested by community leaders in educating people about preventing transmission and working to maximize vaccine access. It's also the result of the efforts of every single person and business who continues to make prevention a priority. And it's the result of everyone who has gotten a vaccine or has shared their vaccination story to help someone else get vaccinated. You all deserve credit for this remarkable achievement, and we thank you and celebrate you as we approach this new phase in our recovery after a very difficult and often devastating year and a half. As California reopens and many safety requirements are lifted on June 15th, the details of which we'll get into tonight, the single most important step every resident can take, if you're able to, is to get vaccinated and to help the people in your lives get the vaccine. For tonight's town hall, we've received hundreds of questions, and while we won't be able to get to all of them, we'll do our very best to answer as many as possible. And as a reminder, you can still send your questions in the chat on YouTube or Facebook, or send your questions on Twitter. In a few moments, Dr. Davis will discuss the reopening masking requirements and best practices for those not yet vaccinated. Lisa Frias will talk about the new Cal OSHA requirements for the workplace and for businesses, and how to contact the Department of Public Health for technical assistance or to report violations. Dr. Gilchick will discuss what will be happening at schools, daycare, and camps this summer, and what may be in store for the fall. And Dr. Kurian will talk about the role vaccinations will play as we move forward. We hope that by sharing important information and answering your questions, we continue our work together to end this pandemic. Thank you again for joining us tonight. And now I will turn it over to Dr. Davis, the LA County Public Health Officer.
Thank you, Dr. Ferrer. Sorry about that. I was trying to get to my mute button. So thanks everyone who's joined tonight for this evening's town hall. Yesterday, the state released their updated masking guidance, and here's what you need to know. Masks will not be required for fully vaccinated individuals, except in the settings where masks are required for everyone, regardless of vaccination status. And that includes on public transit, and examples of that are airplanes, ships, ferries, trains, subways, buses, and ride shares, and in transportation hubs that include airports, bus terminals, marinas, train stations, seaports, and other ports, including subway stations and other areas that provide transportation. They'll also still be required indoors in K through 12 schools, childcare, and other use settings, although this may change as updated K through 12 school guidance is forthcoming, pending updates for K through 12 operational guidance from the Center for Disease Control at the federal level. Masking will still be required for everyone in healthcare settings, including long-term care facilities, and in state and local correctional facilities and detention centers, as well as in homeless shelters, emergency shelters, and cooling centers. Masks will be required for unvaccinated individuals in indoor public settings and businesses. Examples include retail, restaurants, theaters, family entertainment centers, meetings, state and local government offices that serve the public as well. In settings where masks are required only for unvaccinated individuals, businesses or venues or hosts may choose one of the three options. The first is to provide information to all patrons or guests and or attendees regarding vaccination requirements and allow vaccinated individuals to self-attest that they are in compliance prior to entry. They can also implement vaccine verification to determine whether or not individuals are required to wear a mask. An example of that would be checking your vaccination record or your card that you may present to them. And the other could be just to require that all patrons wear a mask. And in that instance, they wouldn't be checking for anything, but they would just be making sure that everyone who enters the facility wears a mask. And to be clear, no person can be prevented from wearing a mask as a condition of participation in an activity or entry into a business. So those of you who feel more comfortable wearing your mask, you can continue to do so, and you can go into any business and participate in any activity without taking it off. We do understand that everyone is at a different stage in their health journey, and there are folks who have not yet determined that vaccination against COVID-19 is right for them, or there are those who cannot get the vaccine for medical reasons. For those of you who are still unvaccinated, I want to share some information about how to protect yourselves when you're out and about. Since, as I just spoke about masks, I want to remind everyone that they continue to be a great way to protect yourself from getting sick if an infected person coughs, sneezes, talks, shouts, or sings near you or in the same room as you. This is especially true if you're in close contact with other unvaccinated people. They are also a great way to protect people around you if you are infected with COVID-19 or many other respiratory infections, whether you're aware of it or not. Another great way for unvaccinated people to protect themselves is by socializing or visiting others outdoors and in uncrowded areas. What makes this protective is that if someone in your group is infected and doesn't know it, viral particles have a harder time of accumulating and infecting others in an open outdoor space when it is not crowded. We in LA County are very fortunate in that most of the year being outside in terms of the weather is pretty comfortable. However, during times when you're unable to socialize or visit outside, bringing in as much fresh outdoor air into the indoor space where you're mingling can prevent virus particles from accumulating inside the air. If you keep visits indoors short and with few people, that's also very helpful and protective. The more people who are inside and the longer they stay, the more virus particles can accumulate. So limiting the number of visitors in your home and keeping visits short can also help reduce your risk. Keeping a distance from other people who aren't vaccinated, whether they are have symptoms or not, and cleaning your hands frequently remain additional important ways for unvaccinated people to keep healthy. Every action counts, and I want to emphasize to unvaccinated folks that you'll get the most protection if you consistently use all of these strategies together at the same time. But you will still get some protection if you can only do some of them. Now, Lisa Frias from our Public Health Environmental Health Division will give you more details on the requirements for workplaces.
Good evening. I'm Lisa Frias, the Director of Environmental Health for LA County, and I'd like to talk about what June 15th means for our workplaces and businesses and offer the latest details regarding Cal OSHA requirements. As California reopens and many of the county protocols get retired, protecting LA County workers will continue to be a top priority for public health. Our goal is to make sure that the communities that were hardest hit during the worst of the pandemic will stay safe as physical distancing requirements and capacity limits for customers are lifted. We recognize that as California reopens and many of the current requirements are lifted on June 15th, we recommend that businesses continue to implement best practices, which are currently being developed and will be available on the county's public health website. to help guide businesses. With respect to employer requirements, last night, the state's Occupational Safety and Health Standards Board decided to retain the current Cal-OSHA's emergency temporary standards in place, while they develop a new set of standards to more fully align with the state's reopening masking guidance. They plan to meet again on June 17th to review the proposed revised standards. If adopted, these new standards could take effect on June 28th. Until then, we must continue with the current standards. In the meantime, with regards to face coverings, all workers indoors must continue to be masked regardless of vaccination status. The exception to indoor mask wearing includes when a worker is alone in a room in their own office, when they're eating or drinking, or they are unable to wear a mask due to a medical condition or a disability, or because of a mask's interference with the work tasks. In these cases, an effective alternative to a mask, such as a drape and a face shield, or a strategy employing both distancing and frequent testing is required. Similarly, the physical distancing standards set in November remain in place, where employers must ensure workers stay at least 6 feet apart from other people if possible. And as a reminder, businesses can continue to reach out to us if they have any questions or if they're in need of technical assistance by calling 888-700-9995 Monday through Friday from 8 to 5 p.m. Workers or the public can also continue to report any violations at that same number, which is again 888-700-9995, or by email by visiting www.publichealth.lacounty.gov/EH. And now I'll turn it over to Dr. Rob Gilchick, who will discuss what will be happening in our schools and what the upcoming school year in fall may look like.
Thank you. Thank you, Lisa. It really is great to be with everyone tonight. Thanks for taking this time to join us. As Dr. Davis mentioned, getting vaccinated is the single most important step each of us can take to prevent becoming infected with and spreading COVID-19. This is true for young people 12 years of age and older. Although studies have shown that COVID-19 in children is usually a mild illness, some children can become very ill or have long-lasting symptoms that affect their health and well-being in the long term. Children can transmit the coronavirus to others if they're infected, just like adults do, even when no symptoms are present. The COVID-19 vaccine protects against this potential harm to children and others, including family members and friends who may be susceptible. Another reason to consider COVID-19 vaccine for your child is to protect the health of your community. Your community includes your neighborhood, your child's school, your friends, and the many people you may interact with as we return to a sense of normalcy. Each child or adult infected with the coronavirus provides a chance for the virus to mutate and create a variant that might prove more dangerous or resistant to the available vaccines and therapies. Fewer COVID-19 infections among the population means less chance of dangerous coronavirus variants. Getting the COVID-19 vaccine can protect your entire community, including schools, as well as the people you love the most. Vaccination against COVID-19 is not currently required to return to in-person learning, but it is LA County's and the state's public health objective to get as many of our 12 to 17-year-olds vaccinated over the coming weeks and months prior to the new school year. By getting our young people vaccinated soon, we can have peace of mind in knowing those over age 12 are protected against COVID-19, both inside and outside of the classroom. Beyond vaccination, I wanted to take a couple of minutes to discuss what to expect in child and youth settings such as schools, camps, and daycare after June 15th throughout the summer and into the next school year. As of June 15th, there will continue to be specialized guidance for child settings, including schools, camps, and daycare. However, Los Angeles County will align our operating protocols and guidance documents completely with the state's guidance. The guidance from the state is not expected to change much from its current form immediately after June 15th. For example, the state's guidance for K-12 schools will only be updated to refer to the new masking guidance from the state. Beginning June 15th, no one in the school setting needs to wear a mask when outdoors. However, everyone will be required to wear a mask when indoors. The same is true for other childhood settings, including daycare and camps. Even if Cal OSHA revises their standards such that fully vaccinated employees can remove masks indoors at the workplace, the more restrictive guidance for schools will take precedence. So the 100% masking requirement in schools, childcare, and camps will remain in force until the California Department of Public Health changes it. The department is watching the Centers for Disease Control and Prevention, or CDC, closely to see if they change their recommendations for masking in the school. And if that happens, the state is likely to follow suit. The other area that will remain in force in our health officer orders is the requirement to report to the Department of Public Health all cases of COVID-19 that occur associated with your institution, and to assist us to the best of your ability with our attempts to identify close contacts who may have been exposed and may need testing or quarantine. Other prevention strategies, or mitigation layers as they're sometimes referred to, contained in the state's school guidance are presented as a series of recommendations to reduce risk of transmission and increase safety for children and staff, rather than as requirements. Examples of these might be cohorting or creating stable groups, physical distancing between children or students, improving ventilation measures, testing of asymptomatic children and staff, screening people for symptoms before entry so sick persons may be excluded, among other strategies. Now, just because these types of activities may no longer be ordered or required by our protocols does not mean public health is recommending they all be suspended. Quite the contrary, these remain effective strategies for preventing transmission and outbreaks, and layering multiple strategies is still the best way to create the safest environment possible. You still should have a COVID-19 safety plan at your facility, and parents should be able to ask, what are you doing here for the summer to keep my child and other parents' children safe from COVID-19, and be able to get a comprehensive response. Lastly, I know many of you are wondering what might change as we move from summer into the next school year. That starts as early as mid-August for many schools. We don't have all those answers yet. The state will be drafting new guidance that will apply to the new school year. Physical distancing is likely to be suspended in order to allow for the full return of students to full-time instruction. There may still be some masking regulations for the indoor setting at schools, given that children under 12 will not be vaccinated by the start of the school year, and a certain percentage of students over 12 may still remain unvaccinated at that time. The precise regulations regarding masking in the schools for the fall are not fully decided and will depend much on any new recommendations that come from the CDC. What we do expect is the opportunity for all students to return to full-time in-person instruction in a safe and supportive school environment. Thank you for letting me share all this information with you. I'll be available for questions. Now I will turn it over to Dr. Sarah Kurian. She will talk more about the importance of vaccinations moving forward.
Thank you, Dr. Gilchick. There is still a lot of work ahead for our department, but we are grateful for the dedication of everyone that's been a part of this effort over the last year and a half. As Dr. Davis and Dr. Ferrer said, this is a remarkable achievement. And as we look toward the June 15th opening and the lifting of requirements, it is important to remain vigilant in our vaccine effort, as getting vaccinated has been and will remain critical to the reopening. As Dr. mentioned, the LA County COVID-19 case and test positivity rates remain among the lowest in the country, lower than other densely populated areas like New York City, Chicago, and Dallas. And we are at this point because of our consistency in mask wearing, social distancing, but mostly our large-scale approach to COVID-19 vaccines. Make no mistake, cases in Los Angeles County are low, largely because of the huge number of people who have been vaccinated. We are quickly approaching 10 million doses of the COVID-19 vaccines administered in LA County. And while this number is impressive, and we appreciate everyone who has taken the time to make an appointment for yourself and others, 65% of LA County residents 16 and older being fully vaccinated is still too low to achieve the community immunity that we need to protect everyone in LA County. This means that all persons who are 12 and older who are eligible for a COVID-19 vaccine should go and get it as soon as they can. At the same time, the Public Health Department is carefully examining our vaccine data by community to ensure that we are reaching those who are most vulnerable, along with those who may not have access or may need assistance to get the COVID-19 vaccine. One of our primary strategies for improving access to vaccines is deploying additional mobile vaccination teams that take vaccines into neighborhoods to reach people who may have limited ability or time to get to one of the established vaccination sites. Our mobile vaccine teams are working with employers and community organizations to provide vaccines at convenient locations where residents and workers tend to gather. We have set up these mobile sites at dozens of work sites, markets, schools, churches, senior centers, and other gathering places all over the county. This week, we have 237 mobile vaccination sites, our highest number in a one-week period so far. We continue to close the gap on the inequities reflected in our data. The inequities are a result of complicated issues, including the distribution of resources and opportunities needed for optimal health. And while we continue essential efforts to ensure good access to both vaccines and information about vaccine safety, we do need everyone's help. Each of us who are vaccinated can approach our unvaccinated friends, family, and neighbors with curiosity and humility about their vaccine decision-making process. We can share our own stories, share what it was that helped us make our decision, and keep the conversation going. And we can offer our company an encouragement to get those in our community to any of the hundreds of vaccination sites across the county when people are ready to get their vaccines. Thank you. And now I'll turn it back over to Dr. Ferrer.
Oh, thank you so much to all of our panelists. I think this gave us a really perfect sort of launching pad for getting straight to the hundreds of questions that have come in. So I do want to thank everybody who's listening to tonight's panel for all of the very thoughtful questions that you sent in. And obviously, we're going to do our best to get to as many of them as possible. I'm going to start, Dr. Davis, with a question for you, which is, does social distancing at all of our businesses and retail establishments, including capacity limitations, end at 12 a.m. next Tuesday? It's really 12:01, I'm sure, is what's meant by that. But yes, Dr. Davis.
Yes, and I'm sure people picked up the 12:01 because that's what we've been putting in our orders. So yes, there will be another order in place, and it will not include all of the business sectors that it has in the past. So on June 15th, all the business sectors that have been covered by the state's blueprint for a safer economy will not have the requirements to limit capacity, nor for ensuring physical distancing among customers. However, businesses may choose to limit the number of people entering their premises, and they are able to do that if they want to. But understand that the requirements for physical distancing will be different for employees because they are subject to the Cal OSHA state regulations to prevent COVID-19 in the workplace.
Yeah, thank you so much. Lisa, sort of in the similar vein of what's going to happen on the 15th, There's a question here. Will we need a mask in a gym after June 15th?
So after June 15th, you will still require a mask if you're indoors and unvaccinated. So they'll continue to be required to wear a face covering. And so, yes, after June 15th, indoors, if you're inside a gym, you will still be required to wear a mask if you're not vaccinated.
Thank you very much. Dr. Kurian, again, after June 15th, will it still be wise for anyone, any age, who's vaccinated to still wear a mask in places like grocery stores and indoor retail, since there may be many unvaccinated people there as well?
It's a great question, and I'll just start by saying, one of the great things about being vaccinated is that you do get an opportunity to have to wear your mask in every single place that you have to go to. And just as a reminder, and this was already brought up, I think, by my colleagues on the panel, vaccinated individuals are still going to be required to wear masks in certain settings, like, in public transportation and transportation hubs, healthcare settings, schools, daycares, in emergency shelters, et cetera. So that requirement is still in place. And regardless, if you want to wear a mask, you can't be prevented from wearing a mask. So if you go into a setting, especially one maybe where you might be in contact with children who aren't yet vaccinated, or with individuals who couldn't be vaccinated for one reason or the other, it might be still something that you would want to do.
Now, I think it's probably also important to note that for people who have an immune system that's suppressed, you really should be talking with your physician or your clinical team to figure out what are the best protections you need to take, even if you're fully vaccinated. That's one group of people for which there's, increasingly some data that suggests that the vaccine is not quite as powerful level of protection for them as it is for everyone else. So please, if you're in that category, before you decide to completely forego that face covering, talk to your clinical team to find out what their recommendations are for you, even when you're fully vaccinated. I want to go ahead now and turn to Dr. Gilchick again with the theme of, what's happening on June 15th. We have a great question. Please give day camps and youth sports a sneak preview of what to expect June 15th.
Well, thank you. That is a great question. I did speak at some length about day camps, which really will be following very similar guidance to schools and to other daycare situations. I think the preview or sneak peek is our kids are going to have a great summer, much better than last summer, that's for sure. But I didn't speak about youth sports, so I'll say a couple of words about that. Again, I think the theme is that many of the current requirements at the state guidance for youth and sports and adult recreational sports, which we will be aligning with, will become more recommendation than requirement. One expected consistent or persistent requirement, again, may be related to masking, whereas indoors, participants who are not actively playing or exerting themselves, on the sidelines, on the bench, staff who are assisting, would all need to be remain masked during the activity indoors. Youth or adults who are actually playing and exerting themselves do have the option to remove the mask while they're playing. The other question we've gotten repeatedly in different venues is about testing requirements for athletes. Again, testing will remain a recommended strategy, but it will not be required for any sport moving forward. Thanks.
Yeah, thank you so much, Dr. Gilchick. And just to reiterate, masking will not be required outdoors for children. So, I know there's just been so much confusion about that, and also a desire for many who are engaging in active physical activity outside to be able to take those face coverings off. So please note, children can take those face coverings off when they're outdoors. Dr. Davis, we've gotten this question a few times, and so I'll try to combine a couple of questions into one. How are businesses supposed to be able to tell if their customers or people or visitors have been vaccinated? Can they ask for proof of the vaccine card? And similar, how does the county, and that means all the businesses in the county, plan to verify if individuals have been vaccinated when they wish to enter a building without wearing a mask?
Thank you. Appreciate that question. So as mentioned, in terms of businesses, yes, they can ask for proof of vaccination, looking at the vaccine card. Again, they have three options. They can have someone, there and ask for vaccination to verify that if you are not going to be wearing your mask inside, that you are vaccinated. They can just provide notice, that says what the vaccination requirements are in terms of wearing a mask or not, and allow you to self-attest, or they can just require everyone who comes in to wear a mask, and they wouldn't be checking vaccination status. But they can ask for proof of vaccination if they are allowing people who are vaccinated to be unmasked inside.
Thank you so much, Dr. Davis.
Barbara, do you want me to answer the question about the county?
Oh, yeah.
Yes, sorry about that. We're, as our department, we're going to follow the state's guidance in terms of masking, in terms of any health office order that will remain. I think at this time, I can't answer the question about which of those options that will be chosen for all of the county buildings, but it is something that, we are all discussing to make that decision.
Yeah, thanks so much, Dr. Davis. I'm going to go ahead and again talk again more about sort of reopening on the 15th. Dr. Gilchick, when or how does the 6/15 reopening impact young children not eligible for vaccination in regards to mask requirements, social distancing, school enrollment, and vaccination requirements?
Great, thanks. Just had to unmute. Well, actually, let me start with the that last piece first, because that's so important. There is not a COVID-19 school entry vaccination requirement, but all pre-existing vaccine requirements for school entry remain in effect, and it's essential that we continue to have our children receive all the usual childhood vaccinations, whether it's measles, mumps, rubella, polio, Haemophilus influenza B, whatever it happens to be. If it's been required for school entry, it's still required for school entry. So please do take your children for all of their usual vaccinations before entering school. That may be the most important point there. In addition to that, yes, the fact that children in childcare settings, preschool settings, elementary school settings, generally speaking, are not going to be vaccinated. They're too young right now to be vaccinated. Based on that, there probably will be continuing mask requirements of some nature for young children and people in the classroom with young students. Other mitigation measures like social distancing. At this point, we are strongly recommending minimum 3-foot distance between students. Does remain a recommendation throughout the summer. The other mitigation measures also help immensely. Do as much as you can outdoors. If you need to have the children or students indoors, do your best to increase ventilation and exchange of fresh air into the indoor space. Have frequent hand washing. Actually, you might want to have scheduled, hand washing times, especially for the younger children, so it can be modeled and make sure they're washing well. And again, the cohorting or creation of smaller, stable groups of students who always stay together with each other and with the same staff, and who don't mix with others from outside, from other groups, is another great way to limit the risk of transmission and outbreak of COVID-19, through your facility or through your school, through your camp. So these are all things that may remain as recommendations and not requirements, but are still excellent strategies to employ, especially when you have a population like the young children who will be, almost wholly unvaccinated throughout the summer.
Thanks so much, Dr. Gilchick. Lisa, a couple of questions that are very specific to special businesses. I'm just going to ask everybody if you can please mute if you're not talking. My business runs as a self-serve. Will I be allowed to go back to that on June 15th?
Yeah, so that's one thing that I do have to say. I know this has been very challenging for a lot of our businesses that provide a lot of food or drinks through a self-service model. So as of June 15th, you will be able to resume those operations. And that also includes, going up and having counter service, going to buffets. I will want to make sure that we still continue to implement, infection control processes such as cleaning and sanitizing regularly, your frequently touched surfaces, making sure that we still continue to practice good hand hygiene, making sure that we still have sanitizer available. But yes, you will be able to resume self-service operations.
Thanks so much for that, Lisa. Sarah, a couple of, I think, good questions that came in that are pretty similar. It says, and I think will be helpful for the conversation as we continue tonight, what risks, if any, do unvaccinated people pose to vaccinated people?
So yeah, no, that's a very good question. And considering the fact that there is still a rare chance that you can get infected even after getting vaccinated, it speaks to the fact that until we reach sort of what we refer to as herd immunity, there is possibility for a vaccinated individual to still get infected after exposure to someone who may be unvaccinated and infected. The good news is that for folks who are vaccinated, even, if you do get infected, the chances are you're going to have a milder form of the disease. Chances are you're not going to end up getting hospitalized. The thing to note, though, and this is something that Dr. Ferrer brought up earlier, is that for folks who might be immunocompromised and vaccinated, the risks to these people are more uncertain. And so for those individuals, again, as Dr. Ferrer noted, it would be important for them to speak with their provider about their status, and risks to them could be greater.
Thanks so much, Dr. Kurian. Dr. Davis, a couple of similar questions here. Again, what's going to be allowed on June 15th? Can musicians playing together sit closer than 6 feet apart if everyone is vaccinated?
It's a good question. And I think, in general, for the public, the distancing requirements go away. I think the question is, for the musicians, are they subject to Cal OSHA requirements? And that, in that case, then physical distancing would still be required in terms of the current Cal OSHA requirements. But it would be a recommendation, especially for those playing wind instruments or singing, to be distanced. But if they're fully vaccinated, again, masking and physical distancing is not required.
Yeah, thank you so much. Dr. Gilchick, will we still need to take people's temperatures to enter buildings like is done now at my school?
Yes. Again, something that might be recommended but not required. Even now in our protocols prior to June 15th, we've never required taking of temperatures. What we did require is some sort of screening so that people who may be ill on that particular day symptomatic with what appears to be a respiratory illness, which could be COVID-19 or could be something else, are excluded from the space and asked to return home until they're feeling better, until they get tested. So again, this screening or temperature taking will be recommendation, but I think what's really important is we still need to exclude people who are ill. So I think the message is, to every individual, if you're sick, please stay home that day. And to proprietors or operators of schools and other child facilities, have some strategy to identify and to exclude people who happen to be ill. There are many different ways to do it. It could be done virtually. It could be done as a home check before the person comes to work or to their camp or to their school. I can tell you, for example, the way we do it here at Public Health. It's really a self-attestation model where every employee is expected to do their own symptom check, and they inform their supervisor before they come to work that they're symptom-free. And that's perfectly reasonable and an adequate way to do things. It's just coming up with a strategy that works for you. You could have signage at the entrance to your facility that reminds people that they need to check their symptoms and please don't come in if you have symptoms. So there's a variety of ways to do it. So the short answer is you are not required to take temperatures, but excluding people who are ill from the workspace or the camp or school space, it remains extremely important. And even as COVID-19 hopefully becomes less of an issue, we'll have influenza in the fall and lots of colds, and the same strategy works to prevent many of these illnesses.
Thanks so much, Dr. Gilchick. Lisa, a couple of other questions about what's going on at facilities. Will tables at restaurants still be required to be a certain distance apart?
No, so that's another one that I do have to say for all of our restaurant businesses. We know that this has been challenging, but we are here now, and we can say that you will no longer have to separate tables or even, have capacity limits to be able to operate your restaurant. So good news, we need to continue, to, of course, make sure that we implement best practices, but your tables can go back to serving multiple families and inviting everybody back.
Thank you. I know that lots of people were happy to hear that. Dr. Kurian, when do you anticipate vaccine safety research and our FDA approval for children under 5 years old would be available for the vaccines?
Sure, yeah. So the research studies are already underway to study, the effectiveness and safety of the vaccines in younger pediatric populations. So we're really hoping that they will have enough data to submit an application for authorization for younger age groups. We're hoping sometime in the fall. I will note that, currently only Pfizer is the only vaccine that we can currently use for children 12 and over. But Moderna is getting ready to submit their application. So hopefully pretty soon we'll have a second vaccine available for that age group.
Oh, thank you so much. That's very hopeful. Dr. Davis, this is a question from a pastor in West LA that has conducted services online for approximately 65 weeks. I know that many of my colleagues are eager to have very clear guidelines for in-person worship services for the faith community. Will public singing be permitted or continue to not be recommended?
It's a great question, and thank you for altering your practice and still providing service to the community online for that period of time. We know that it's been tough and required a lot of many of you and your colleagues. In terms of singing, again, the sector-specific guidance goes away We've had no indication from the state that they intend to do anything specific related to singing, chanting, etc. So at this point, things can go back to normal in that regard. Again, singing can be a risk, but masking for those who are indoors and unvaccinated is something that still falls under the state guidance in that. And there are probably still, unless you know everybody is vaccinated, probably still a good practice if those things are going to happen because they're at higher risk for those who are unvaccinated to wear face coverings. Just because it'll be riskier indoors with that type of activity should someone unknowingly be infected.
Oh, thanks so much. Let's see, so many questions here. Lisa, if employees of restaurants want to continue wearing PPE because they don't feel safe yet, vaccinated or not, do employers need to continue to provide that PPE?
So currently, Cal OSHA still has their emergency temporary standards in place, and they do require that employers provide the appropriate PPE, which includes face coverings. So we'll have to wait and see what the future holds as far as the standards that do get adopted by Cal OSHA. But as of today, yes, they are required to provide employees with the proper PPE, including face coverings.
Oh, thank you. And again, we're sorry for the uncertainty in where we may be, by at the end of June with workplace requirements, but we'll all just pay attention to what comes out of the Cal OSHA board meeting, standards board meeting on the 17th. That'll give us a good indication about where businesses are going to land in terms of requirements related to prevention of COVID-19. I want to just go ahead, Dr. Gilchick. What changes will happen to colleges and universities after June 15th? Specifically interested in knowing what changes you anticipate for the fall semester.
Yes, for the fall semester, things will look much closer to sort of normal or pre-COVID than they do now. There won't be any capacity limits. In terms of classroom occupancy. There probably will be no physical distancing requirements of any kind. Again, masking requirements outdoors there are none. Indoors, hard to say for sure at this moment, particularly for people who may be who may remain unvaccinated. I think for student residents, again, it will be more recommendations than requirements, but highly recommended that everyone living in congregate living be vaccinated. It may not be a requirement, but if students who may be living on campus in a congregate residence hall who are not vaccinated, the recommendation is that they be given single rooms, preferred. I do know in terms of guidance that the state is retiring their industry guidance on June 15th for institutes of higher education. They are referring colleges and universities both to Cal OSHA guidance moving forward and to the CDC recommendations for institutes of higher education, which actually were just posted about a week ago. So those are good references to refer to for more detailed guidance.
I just want to clarify that right now it's very clear at colleges and universities, people who are not vaccinated do need to wear their masks whenever they're indoors. So, and we're not really sure where this is going to land for the fall, but as of right now, everybody who's indoors, who's not vaccinated, is required to put on that face covering. I also want to, sort of be clear, as Dr. Gilchick has been, we are fully aligning with the state on this. So we're not going to have an additional set of requirements for colleges and universities. We will issue some best practice guidance, but folks should, as Dr. Gilchick mentioned, go ahead, take a look at what CDC just posted. The state is likely to really closely mirror that and as he noted, not issue separate sector protocols for institutes of higher education at this point in time. We'll go ahead, Dr. Davis. I'm just going to go back again. I think this question has come up like 5 times, so I think it's of a lot of interest. Are vaccines going to become mandatory in any situations? If so, in what situations?
At least at this point, we're not aware of the vaccines becoming mandatory as they're currently under emergency use authorization. I think we have heard from some industries, like in some of the colleges, that they want to require it once the vaccine becomes licensed by the FDA. But at this point, we haven't had any specific indications around any broad or sweeping requirements in terms of the vaccines.
Yeah, I would qualify that and just say government hasn't issued any mandates for people to get vaccinated, but private businesses have. So if you're working for an employer and the employer is requiring vaccinations, that actually is something the employer is allowed to do. And you would need to talk with your employer if that's a situation you find yourself in. It's just not been mandated. You know, we're not mandating it. The state's not mandating it. The federal government isn't mandating. But we do know that there are some private businesses that have already required that their employees, in fact, all get vaccinated, with most of them, of course, allowing for medical and religious exemptions. But if that's a situation you find yourself in, please go talk with your employer about that. I'm going to go ahead and Dr. Curry, just a couple of sort of interesting questions here again on staying on vaccinations, and what might be protections that people who are not yet vaccinated ought to take. This is a question: if the virus is never going to go away, and everyone isn't going to get vaccinated, what should I be doing to protect myself as a person who is vaccinated?
Yeah, that's a great question. Something we have alluded to already is, one of the great things by people going out and getting vaccinated, the more people in our community that get vaccinated, it helps protect everyone. It creates that sort of what we call herd immunity or community immunity, and protects those who can't get vaccinated. But if we find ourselves in a situation where over time we don't get to sort of that level and folks don't get vaccinated, what happens is that there is still chances for vaccinated people to potentially get infected, because although the vaccines have been really, extremely effective in preventing infection and transmission, it is still a possibility. It's not, 100%. So people can still get infected. What you can do, is pretty much what we would recommend for any infectious disease is, of course, hand washing and, taking those type of precautions to really just kind of make sure that you stay healthy in general. But vaccination, the fact that you got vaccinated is definitely a huge protective measure, and something that we really are hoping that we can encourage everyone to sort of really move towards. And that's one of the things that that our team right now is really trying to do, is trying to get the message out there, address concerns that people who are in that remaining group of people who haven't gotten vaccinated, trying to understand sort of what some of the barriers that might still exist for them might be, addressing myths and other misinformation that might be out there that might be preventing them from getting vaccinated. But really, our hope is that we do get to a point where we do have more people getting vaccinated to help protect everyone, even those who have already gotten vaccinated.
Oh, thanks so much. Lisa, am I going to be able to, this is a question, am I going to be able to reopen my restaurant nightclub after June 15th?
Yes, you will be able to open up your restaurant nightclub. I know that's something that again has, been closed this entire 15, 17 months. And so you will be able to welcome back and provide entertainment. Once again, we still, will encourage you to have best practices in place to make sure that you can continue to, of course, protect your customers. And we'll have to wait and see, what the Cal OSHA standards look like for your employees. But as of June 15th, you will be able to reopen and invite customers back in.
Oh, thank you. Dr. Gilchick, a person sort of sent us this note. My question is about the very real risk of myocarditis and pericarditis in children 18 and under who have received the vaccine. Should children still get vaccinated even with these possible risks?
Yeah, thank you for that question. That is a potentially serious condition. However, one really has to balance and weigh the risks. And if one weighs the risk of, as you say, post-vaccination myocarditis or pericarditis, which is a very infrequent symptom or problem, compared to the risk of being infected with COVID-19, potentially becoming very ill, potentially infecting others who also may be vulnerable, potentially needing to be hospitalized and even pass away, which is a very small risk for young children, but actually the risk outweighs the risk of vaccination. And last but not least, long-term complications that can happen after COVID-19 with lasting symptoms that can affect a number of different organ systems. And of course, the multi-system inflammatory syndrome that can happen after infection with COVID-19. Again, a fairly rare event, but more frequent and higher risk than complications from the vaccine. So if you weigh the risks, the best advice based on that evidence, based on that data, is yes, please get your children vaccinated. They and the community will all be safer for it.
Thank you so much, Dr. Gilchick. Dr. Davis, a question about the skilled nursing facilities. Are there going to be new protocols for the skilled nursing facilities? And will the skilled nursing facility have the liberty to set their own precautionary measures for the sake of their residents?
So in terms of this, the protocols, if you're speaking about, guidance or requirements from us, our requirements have typically followed the state's all facility letters related to skilled nursing facilities or long-term care facilities. And those really set the requirements for skilled nursing facilities. I will note that there were two updates, one which was posted on June 2nd, that was related to visitation guidance, and it included some recommendations about mask wearing, noting that fully vaccinated visitors and fully vaccinated residents may remove their mask and touch. Visitors still need to wear a mask in the common areas, but if you're visiting your family member in their room, and there's no others in there, and both are fully vaccinated, that can happen. Unvaccinated visitors or residents can visit indoors, but need to maintain physical distancing and mask wearing. And then fully vaccinated residents may dine together without physical distancing or mask. And if the vaccination status is unknown or a person is not fully vaccinated in an activity, then all residents need to wear a mask. In terms of can they set their precautionary measures for the sake of their patients, I think it depends, one, on what's required, and two, what they are seeing based on their facilities. So there are certain infection control requirements that they must follow. And those, again, are usually set by the state in that regard. And then there are other all facility letters that were released related to testing, but I'm assuming that in terms of that question was really related to people in general and visitors, but there are all facility letters that have been updated to account for people who have been fully vaccinated.
Oh, thanks so much. Lisa, this is a fairly technical question, but I think as we're doing all the reopenings, it's a really important question. Is the LA Department of Public Health recommending businesses retrofit existing HVAC systems or acquire portable air filtration, air scrubbing units to achieve a healthy air exchange?
So that is a really good question. And I think right now, with respect to our existing buildings, where you're not going to be able to, whether it's, due to cost, we definitely would still recommend that you do have air purifying systems and, even portable ones in the facility. There will be requirements that Cal OSHA will continue to require that employees be protected, and ventilation is one of those protections. So this is something that I don't anticipate going away, even with new standards. It is part of a COVID-19 workforce prevention plan. So ventilation is something that, while in the past we hadn't looked at closely, I think now as we continue to, whether we do upgrades, whether we build new buildings, we're going to have to now consider what the ventilation impact is. So definitely continue to have, doors open, bring in as much outdoor air in. Really look at your filters, make sure that you're changing them regularly, and have those air purifying systems in place, because ventilation will continue to play a role in this, and that's why it's really important that we get more people vaccinated to minimize that risk.
Yeah, thank you so much. And just sort of moving along on, getting people vaccinated, we have a great question, Dr. Curry, maybe you could answer. Will there be any mobile units in our neighborhood giving out vaccines? How can we find out where those mobile units will be?
Oh, that's a great question. Yes, we continue to deploy our mobile units and make them available to folks who want to have an on-site vaccination opportunity. So if you go to our website, vaccinatelacounty.com, we do have a couple of maps that are on that website that show where our mobile vaccine clinics are. And there's also information there on, for example, if you're a business and you'd like to have a vaccine clinic at your place of business, there's a form you can fill out to request a mobile vaccine clinic to come out to vaccinate on site.
Yeah, thanks so much for that. And we're always happy to get questions about needing a mobile unit. And as I tell everyone now, if you're an employer, a business, you work with a trade association, and you've got a group of people that need to get vaccinated, please give us a call. We're happy to make sure a mobile unit gets out to you. So again, this is driven a lot by demand at this point, and we try to be as responsive as possible. So we love getting requests from everyone about the need to bring a mobile unit into their neighborhood. Dr. Davis, I think, this is a question that really is probably top of mind to lots of people who are being asked to start getting back into their offices or their work sites now that the community transmission rates are so low. What is the safest way to bring both vaccinated and unvaccinated employees back to the office in regards to wearing masks?
Well, again, in this situation, there are some requirements set by Cal OSHA in terms of their current standards. And at the moment, everyone needs to be wearing a mask. And as was mentioned earlier, Cal OSHA, changed or chose to keep the prior requirements in place, which still includes physical distancing between employees and that everyone is wearing a face covering. We expect that, maybe come the end of June, there may be a revision to that, and that remains to be seen exactly what they say in those, if they account for people who are fully vaccinated, and those people do not have to wear masks. But in general, at this point, up until that time, everyone needs to have a mask on when they're coming back to work.
Yeah, thank you. Dr. Gilchick, this is a question from a person who runs a summer program for kids ages 8 to 16. On a normal year, we like to go on field trips. What are the latest guidelines for transporting kids post June 15th? In our case, we'd be using a 15-person passenger van.
Well, the best recommendation would be really to treat that transportation as an indoor space. Yes, the bus is outside, but when you're all on the bus together, you are enclosed in a space. So it would be safer to treat that as an indoor space and to have all the young people, everyone wearing masks really inside, to increase ventilation as much as possible. Which is to open up as many windows as you can, safely. That will really increase the air exchange quite a bit and make it more like an outdoor environment. So that's very important. The last thing, which is a recommendation, it won't be a requirement, certainly after June 15th, regards distancing among youth. And if you're able to alternate seats so that there's a little bit more space between passengers, that also will increase safety and lower risk. However, that will be a recommendation. You do have the option of occupying every seat. Just have the knowledge that that might increase risk a bit more. It depends on the needs of your program, the transportation resources available. But the best, again, speaking of best practices, the best practice would be to maintain some distance between passengers. Since many of the youth, the children, are not going to be vaccinated, and use alternate seating.
Thank you, Dr. Gilchick, for that great response. Lisa, will restaurants and bars be allowed to ask patrons for proof of COVID-19 vaccination? And will they be allowed to deny service to people who are not vaccinated and don't have proof of a recent COVID-19 test?
So, that is going to be up to a restaurant on how they want to address their customers. So if they have a policy that they implement that only those coming into the restaurants, they have to be fully vaccinated, then they can ask for proof that they're vaccinated. So that is, a decision that a restaurant can make. Similarly, if they want to have a policy that requires that anybody coming into the restaurant, whether they're eating outdoors or indoors, continue to wear a face covering, they can also implement that policy. So it would be a policy for the restaurants. Where there may not be a regulatory requirement, that is still something that businesses have the option to do, whether it's a restaurant, a grocery store, or any other type of business. I think we lost our volume.
You can hear me? Okay, great. Dr. Davis, there are a few questions sort of, really in the same vein here about why don't some people want to get vaccinated, and should we just make it mandatory either now or as soon as it has full FDA approval so that we get everyone vaccinated as quickly as possible?
It's a good question, but I think, we have always, in many instances, unless we see a clear risk, and we've seen that over the years in terms of outbreaks at schools related to diseases that could be prevented with a vaccine. I think, if we start to see that, then I think at that point, once maybe it's licensed, there may be some requirements that are put in place. But in general, as we're still under this emergency use authorization, we have to do the best that we can to answer people's questions. Sometimes that may have to be a number of different times, and to provide opportunities for easy access to getting the vaccine. And we've seen over time that even people who have been resistant initially, they have gotten it. So it just may take longer for us to get to that point than we hoped to get to. But in general, we're going to continue providing accurate information and being in a number of different places for people to be vaccinated.
Thank you so much. Dr. Kurian, there's a whole host of vaccination questions that have come in. One of them I think is top of mind for lots of people. Should individuals who have suffered through COVID-19 be considered to have the same status as fully vaccinated individuals? And is there any reason why a person who already had COVID-19, especially if they had it recently, for them to get vaccinated?
Yeah, great question. So, there's a lot that we're still learning about COVID-19, the disease, and so what happens after you've received disease, after you've had the disease, and how long immunity lasts. So currently, based on what we know, our recommendations is that even if you've had COVID-19, that you do go ahead and get vaccinated. And so really, the idea is that you get vaccinated. Say you get infected, as soon as you're out of your isolation period, you can go ahead and get vaccinated, and that is what we are recommending to people, to go ahead and do that.
Yeah, thank you, and thanks to everybody. We had a lot of people send in similar questions there. Dr. Gilchick, we get a few questions about this as well. Do we know why kids don't get really sick from COVID? And a lot more questions about, and if they don't get very sick, why should they get vaccinated, and why do they need to wear masks? So it's a lot put in there, Dr. Gilchick.
Sure. That's a reasonable question. I'll do my best to answer that. The best evidence we have is that children may be they're less likely to become infected with COVID-19 compared to older adolescents and adults. They're less likely to get very ill from COVID-19, and they may be less likely than adults to transmit COVID-19. But that being said, it's absolutely true that they can and do get infected, they can and do become ill, and they can and do transmit the infection to others. Even if, now, I don't know if we have all the answers biologically why they are less likely to get infected or less likely to get sick. One theory has to do with the receptors or the cells in the respiratory lining where the virus actually attaches and enters the body, known as ACE receptors. And it is known that the older one gets, the more of these receptors there are in the nasal passage and in the respiratory tract. The younger you are, the less receptors you have. So that is a good logical explanation and theorized to be one of the reasons why young children are less likely to be infected. There are a few theories about why they may be a little bit harder for them to transmit the infection. For one thing, little kids have small lungs and don't have big lung volumes when they breathe in and out, so they may not be expiring as many viral particles. Also, really young children are really short, so it's a little bit harder maybe for them to breathe or sneeze or cough into older children's and adult spaces. So these are some theories. They're logical theories. I don't know that they've been proven, but we do know statistically that children don't get infected as often and don't get as sick. That being said, we do have some tragic stories of children becoming really ill, of being hospitalized, a few even passing away. There is this post-viral syndrome that I mentioned before, the multi-system inflammatory syndrome, which can be devastating and fatal. Very rare, but if it happens, every child it happens to is an absolute tragedy. If the vaccine can prevent all of that and is far safer than having the infection itself, why not get the young person vaccinated? Last but not least, even if the child is not at much risk as the adult is, but if the child can still transmit the infection to older people who are much more susceptible and if unvaccinated, more likely to have a poor outcome, to become very ill, to be hospitalized and even die, vaccinating the child is then potentially protecting all of those more susceptible people. So there's a few reasons why it really does make sense, both for the benefit of the individual child and for the benefit of their family, their loved ones, and the surrounding community, why we really need to vaccinate everyone regardless of age.
Oh, thank you so much, Dr. Gilchick, for that. Lisa, there is a question here that I think lots of people are also thinking about. There are some safety measures that got implemented during COVID-19 days, like cleaning and disinfecting, that we actually like. But are these going to go away now that there are no health officer orders requiring them?
Yeah, so great question. While there's no health officer order requiring them, we do have the Cal OSHA standards that are still in place that to some extent will carry over to really help not only the employees, but also those customers that are going into these areas. So there's cleaning and disinfection requirements that will continue to be required. So if you have areas that are frequently touched, those will continue to, of course, require that you clean and disinfect them regularly. So it's still a lot of what we've learned, and I mentioned this, is we have some really great practices that we realize now work to minimize any type of disease. And that once again goes to bacteria and viruses. And so to keep all of us healthy, we should continue with these best practices, regardless of COVID-19. It'll help keep your employees safe, it'll help keep your customers safe. So yes, please continue with cleaning and disinfecting, frequently touch surfaces regularly. You don't have to do what we did in the beginning, which is an hourly disinfecting process, at least once a day though. Make sure that you're going in and doing a thorough cleaning of all those areas that are frequented by many people.
Thank you so much. And yeah, I want to also emphasize there are also, just standards at many of the licensed facilities, particularly those that serve food, that really require a level of cleaning and disinfecting as well. So places where food is being produced, manufacturing plants, also have, not necessarily related to COVID, but as Lisa was saying, there's other regulations that actually require sanitation and disinfecting. Oftentimes in the past, I think as either consumers or workers, we weren't paying a lot of attention to them. Now we are, and I think we can also sort of influence what happens at workplaces and places where customers are by asking that those kinds of services be easily available to protect all of us. Dr. Kurian, a question here that I think also is very important, and many people have asked this question as well in different ways. I got vaccinated with Johnson & Johnson, but I didn't have any side effects. Do I need to now go get the Pfizer vaccine just in case to make sure I'm actually protected?
No, if you did get the J&J vaccine, it is a single dose vaccine. That's great that you didn't have any side effects. And most people, if they have side effects, they're oftentimes minor. Others may have, a little bit of soreness and redness, and with the 2-dose vaccines, some have complained of more significant side effects after the second dose, but that's not everyone. So if you were one of the fortunate folks that didn't get side effects after your J, I guess just, have a little happy dance there, but you are considered vaccinated. There is no need for you to go out and get vaccinated again with either the Pfizer or Moderna.
Yeah, thanks so much. And that is a question a lot of people ask. I didn't have any side effects. I think that means that I didn't mount any kind of response, and that's not accurate. Really, if you look across all of the vaccinations that are being given to people, probably almost close to half of people say they either had very mild side effects like a sore arm for an hour or two, or they've had nothing at all. So please don't worry. But I know that lots of people have asked us, I don't think I actually am protected because I didn't have any side effects, and you are protected. So the evidence is really overwhelming about how much protection you have. Dr. Davis, I wonder, there are a couple of questions about herd immunity, community immunity. How close is the county to reaching community immunity? What is considered community immunity? And what can stop us from getting there?
That's a great question. And, the level of percentage of people that would need to be vaccinated to get herd immunity varies by disease. In LA County, we've talked about reaching 80% based on, some estimates that some have made, but we've seen ranges of estimates anywhere from 70 to 90%. And, so for us, we've chosen 80% as a goal. However, community immunity is really about having enough people vaccinated in the area you are that infection doesn't transmit easily because most people are protected. And we know that as we start to see the level of disease in community, the number of cases that we are seeing, and you've seen that with our rates going up in terms of vaccination, the numbers of cases have remained low, but they could be lower. So I still think that we need more people vaccinated in order to get to that community immunity. But the 80% goal is what we've chosen based on some estimates that some experts have put out there. But really, we're watching the cases, we're watching the hospitalizations and deaths, and tracking to see and be sure that the people who are getting infected aren't really the people who are vaccinated.
Thanks so much for that, Dr. Davis. I mean, I might ask you to just continue, sort of on that vein a little bit, because the question comes up then, when will we be able to lift the mask mandate entirely, and is that related to getting to herd immunity? This is particularly, we've gotten a few questions from parents who wonder why at indoor schools, indoors at schools, children will have to keep their masks on. And, the question is, is it going to take, if we get to herd immunity, does the mask mandate disappear entirely?
I think as we again look at what we're seeing in terms of cases, and hopefully the vaccinations will be available for those who are under 12, so more of us can be protected by the vaccines. Then, at that point, maybe that masking requirement goes away. At this point, we haven't seen any hard numbers. We have seen new variants of the virus show up. Fortunately, the vaccines have been protective against those. But again, I think it'll be a judgment call as we continue to see what we see in terms of cases and who's susceptible to it. That'll give us a better sense as to whether or not these masking requirements need to be in place. I think partially the reason that it's also still in schools is because you have a wide range of students that aren't able to be vaccinated because they're not eligible. The vaccines aren't authorized for their age group. And in schools, often it's difficult to keep kids apart. And we know that we've seen outbreaks during the flu season inside of school settings. So we want to make sure we're as protective as we can be, in this instance, even in this time where we have lower case numbers.
Yeah, thank you so much. Lisa, this is kind of a fun question for all of us, and probably something we're all looking forward to. Is it safe to have a 4th of July barbecue, and is there anything I should know about this?
Well, it will be safe to have a 4th of July barbecue, and so I'm looking forward to it. Again, we want to make sure that we do it outdoors. We want to be able to make sure that we keep our food safe. We practice good, hand hygiene, and we really take some time to reflect to some extent. This has been a very tough year for all of us, and I think what we've learned is that it's made most of us stronger. For others who have lost individuals, that's very heartbreaking. But please make sure that you do have a safe 4th of July by doing it outdoors. Outdoors is the best place for us to celebrate together. And once again, just be safe.
Thank you. Dr. Gilchick, this will probably be our last question before we go into some closing remarks. So maybe, a quick answer. This is a teacher asking, she's returning to summer school in-class instruction, and she's realized that she'll be needing to keep her mask on for many hours in a row, and she's wondering if that's safe.
Yes, I'll address that. I did have to add, for the safe 4th of July, go find a professional fireworks show to see. Don't be cautious with the fireworks at home. That's another safety issue. But regarding your question about the teacher masking, well, yes, it is safe. Understandably, wearing the mask for many hours in a row can become a bit uncomfortable. The mask can become somewhat wet or moist just from the water vapor that's in our own breath. I think that you should probably try to schedule in some quote unquote mask breaks where you can find an area where you can be alone, not near any others, outdoors, and you are allowed to take your mask off at that point in time. And so during your break time, do take advantage of the ability to remove your mask outside. It's also good to have a change of mask so that maybe you can change it once during the day, or even more frequently if needed. So if the mask becomes quite wet and doesn't really provide is uncomfortable and doesn't provide the same level of protection when it's wet like that, you can change for a new dry mask. But yes, the question, there's no particular risk or danger to wearing the mask throughout the day.
Yeah, thank you so much. And we only have a couple of minutes left, and I want to give each of our panelists first, deep appreciation and thanks. You did an excellent job. We had wonderful questions, really thoughtful questions from everybody who was in our audience tonight. I appreciate also the critical information that you provided everybody. I'd like to just give everybody a few seconds to close us out with parting remarks. I'll start with Lisa.
Great. So I just want to say thank you once again for spending some time with us to talk a little bit about what's next. Want to make sure that you can reach out to environmental health. Once again, I'm going to go ahead and, oh my goodness, I lost the number. Let me see if I can I will pull it up at the end. But you can continue to reach out to us for technical support. We are going to continue to be here to support you. Also want to make sure that we will continue to go out and do inspections at businesses to make sure that they do follow all the existing requirements, like Dr. Ferrer mentioned. Restaurants will still be following, California Retail Food Code requirements. We'll be making sure that the ocean is safe for you to go into, your pools are safe to recreate in, and that your water is safe to drink. So we'll continue to do all of that to make sure that you continue to be safe. So thank you once again.
Thank you so much, Lisa. Dr. Kurian, any last thoughts?
Sure. I think I just want to take a moment to really just appreciate everyone who's taken time out of their busy schedule to participate and send in questions and listen to what we've been saying tonight. I think the sheer fact that you guys have tuned in means that you're interested, you're curious, and you want to protect yourselves and you want to protect your loved ones. So really encourage you to continue to ask questions, to seek information, and then take that knowledge and really, encourage folks who may not have gotten vaccinated yet to come in and get vaccinated. If you're still curious and thinking about it, definitely reach out to folks that you trust, get information, and come in when you're ready to get vaccinated.
Dr. Gilchick? A quick last comment.
Yeah, as I regarding again our children and youth in particular, when I think about where we were a year ago, at the onset of last summer, and how restrictive things were for our young people during the summer. I just think it's so exciting to be at this point where, you know, there's going to be so much more freedom, flexibility, and I think young people really can look at a season of rejuvenation, recuperation, rebirth almost, and hopefully have a great summer and a new school year.
Thank you. And Dr. Davis?
Once again, thanks everyone, and thanks to all my colleagues who were on here answering questions. Appreciated listening to all of you as well in terms of your responses. And to everyone, you know, we are in a very different phase from where we were before. Our case counts are lower, but there's still risk for those who are unvaccinated. And we encourage everyone who's unvaccinated to get your questions answered, come into the sites to be vaccinated sooner rather than later. But do understand there's still some risk. And we are in a transition. And if you go into a business and they require you to wear a face covering and they're not going to check to see if you're vaccinated or not, please go ahead and do that. It's really based on their concerns for their workers and others there. And we ask that you respect that, moving forward. Again, we are in this transition phase. But thank you for all your questions.
Yeah, so thank you, everyone. Buenas noches a todos. I, too, want to echo my deep appreciation to the panelists and also to everybody who joined us tonight. And I want to thank everybody, not just for joining us, but for everything you've been doing to keep yourself safe, your family and your friends, your community, your workplaces safe. We're in this together. We're getting out of this together. Our job right now is just to continue to take care of each other. So as we move forward in this summer, where we're going to have a lot more opportunities to be together, please make sure that we're always mindful of our obligation to each other as we move through our recovery journey. So thank you very much.